In recent years, a wave of interest has surged around a drug called Ozempic, primarily for its weight loss effects. Originally developed to manage type 2 diabetes, Ozempic's active ingredient semaglutide has shown surprising potential for people looking to shed pounds, but with the growing buzz comes confusion, misinformation, and important questions about its true effectiveness, risks, and whether it's a sustainable long-term weight loss solution. This video dives deep into the science behind Ozempic, explores its mechanisms for weight loss, and discusses the potential risks and benefits to help you make an informed decision about whether Ozempic is right for you. What is Ozempic? Ozempic is an injectable medication initially approved by the FDA to treat type 2 diabetes. Its primary role is to improve blood sugar control in adults. The drug contains semaglutide, which belongs to a class of medications known as GLP-1 receptor agonists. These drugs mimic the action of a hormone called glucagon-like peptide-1 or GLP-1 that stimulates insulin production, helping lower blood sugar levels after eating. GLP-1 also slows down digestion and reduces appetite, which is where the weight loss benefits come into play. Though it was not originally designed as a weight loss medication, researchers began to notice a trend. Patients using Ozempic to control diabetes were losing weight. This spurred further research into the use of semaglutide specifically for weight loss, leading to the development of Wegovy, a higher-dose version of semaglutide marketed explicitly for obesity management. How does Ozempic promote weight loss? Ozempic works in several ways to promote weight loss. Appetite suppression. Semaglutide acts on receptors in the brain to reduce feelings of hunger, making people feel full sooner. This leads to reduced caloric intake, which can result in weight loss over time. Slowing digestion. By delaying the emptying of the stomach, Ozempic increases the time it takes for food to move through the digestive system. This not only keeps people feeling full for longer, but also stabilizes blood sugar levels, which can curb cravings for sugary foods and prevent overeating. Improving insulin sensitivity. For those with insulin resistance or prediabetes, semaglutide helps improve the body's response to insulin, potentially preventing further weight gain associated with elevated insulin levels. Reducing fat storage. Some studies suggest that GLP-1 agonists may reduce the body's propensity to store fat, although the exact mechanism behind this is still being studied. How effective is Ozempic for weight loss? Research into Ozempic's effectiveness for weight loss has been promising. In clinical trials, participants using semaglutide lost, on average, about 15% of their body weight over 68 weeks, compared to just 2.4% in the placebo group. This translates to significant weight loss for many users. However, results vary from person to person. Some people may lose more weight, while others may see more modest changes. The effectiveness of Ozempic for weight loss also depends on accompanying lifestyle changes. People who combine the medication with a reduced calorie diet and increased physical activity tend to see the best results. Despite the success in trials, it's essential to understand that Ozempic is not a magic bullet. Users must commit to maintaining healthy habits for the medication to be effective long-term. The pros of using Ozempic for weight loss. Effective weight loss. For many people, Ozempic offers a level of weight loss that may not have been achievable with diet and exercise alone. This can be particularly beneficial for individuals struggling with obesity or weight-related health issues. Improved metabolic health. Ozempic can help improve insulin sensitivity, reduce blood pressure, and lower cholesterol levels. These benefits are especially crucial for people with type 2 diabetes or those at risk of developing the condition. Appetite control. By suppressing appetite and reducing cravings, Ozempic makes it easier for individuals to stick to a calorie-reduced diet, helping them avoid common pitfalls of dieting such as constant hunger or feelings of deprivation. Potential long-term weight maintenance. Some users have found success in maintaining weight loss while continuing to take Ozempic, though this requires long-term use of the drug and ongoing lifestyle modifications. The risks and side effects of Ozempic. Like any medication, Ozempic comes with potential risks and side effects. While many people tolerate the drug well, others may experience issues that could impact their decision to continue its use. Gastrointestinal issues. The most common side effects of Ozempic are related to the digestive system. These include nausea, vomiting, diarrhea, and constipation. In many cases, these symptoms diminish over time as the body adjusts to the medication. However, for some, these side effects can be severe enough to require discontinuation. Risk of hypoglycemia. Although the risk of hypoglycemia or low blood sugar is lower with Ozempic compared to other diabetes medications, it can still occur, especially in people who are also taking insulin or sulfonylureas. Symptoms of hypoglycemia include dizziness, shakiness, confusion, and sweating, and it requires immediate treatment with sugar. Potential thyroid tumors. In animal studies, semaglutide has been associated with an increased risk of thyroid tumors, including medullary thyroid carcinoma, or MTC. While no such link has been conclusively demonstrated in humans, Ozempic carries a warning regarding the potential risk of MTC. People with a family history of thyroid cancer should discuss this with their doctor before starting the medication. Gallbladder disease. There is some evidence that Ozempic may increase the risk of gallbladder-related issues, including gallstones, which may require surgical intervention in severe cases. Pancreatitis. Although rare, there have been reports of pancreatitis or inflammation of the pancreas in people taking GLP-1 receptor agonists like Ozempic. Symptoms of pancreatitis include severe abdominal pain, nausea, and vomiting. Who should and shouldn't use Ozempic? Ozempic is typically prescribed for individuals with type 2 diabetes, but it may also be considered for people with obesity or those struggling to lose weight through diet and exercise alone. Doctors generally recommend Ozempic for patients with a BMI or body mass index of 30 or higher, or for those with a BMI of 27 or higher if they have weight-related medical conditions such as hypertension or high cholesterol. However, Ozempic may not be suitable for everyone. People with a history of medullary thyroid carcinoma, a family history of multiple endocrine neoplasia syndrome type 2, or those with a history of pancreatitis should avoid using Ozempic. Additionally, pregnant or breastfeeding women are advised against using the drug as the effects on fetal development are not fully understood. Is Ozempic a long-term solution for weight loss? One of the most pressing questions for people considering Ozempic for weight loss is whether it offers a sustainable solution. The reality is that Ozempic is not a cure for obesity or a permanent fix for weight loss. As with many weight loss drugs, the effects of Ozempic wear off if the medication is stopped. People who discontinue Ozempic often regain the weight they lost, especially if they have not made significant lifestyle changes to support their weight loss. For this reason, doctors often recommend that people taking Ozempic for weight loss view it as part of a broader, long-term strategy that includes dietary modifications, regular physical activity, and behavioral therapy to address the underlying habits and emotions contributing to overeating. The cost of Ozempic for weight loss. Another factor to consider is the cost of Ozempic. Since it is primarily marketed as a diabetes drug, insurance coverage for its use in weight loss may be limited. In the United States, the price of Ozempic without insurance can range from $800 to $1,000 per month. This makes the drug a costly option for people without diabetes who are interested in it solely for weight loss purposes. Some people may qualify for prescription assistance programs or receive coverage through their insurance if they have other health conditions that warrant its use, such as type 2 diabetes or prediabetes. For others, the out-of-pocket expense may be a barrier to long-term use. Conclusion: is Ozempic right for you? Ozempic offers promising results for people seeking to lose weight, particularly for those with underlying health issues like diabetes or obesity. However, it's important to remember that the drug is not a miracle solution and comes with potential risks and side effects that need to be carefully weighed. Before starting Ozempic for weight loss, consult with a healthcare provider to discuss your medical history, weight loss goals, and whether the drug is appropriate for your situation. While Ozempic can be a powerful tool in the fight against obesity, sustainable weight loss ultimately depends on a combination of medication, lifestyle changes, and a commitment to long-term health.